This segment of DelmarvaLife is sponsored by Delmarva Dental Services.
The oral care industry is a quite lucrative one. For example, approximately 3.5 billion, with a B, billion toothbrushes are sold each year worldwide. They go right along with the 20 billion tubes of toothpaste sold.
And if you walk down the oral care aisle of the store, you will see several different varieties of both the toothbrushes and the toothpaste. And you also find many varieties of other oral care products such as dental floss. But all those products are worthless if you don't know how to use them properly. Well, I recently stopped by Delmarva Dental Services to take a little class in Dental Care 101. Toothpaste, a toothbrush, and maybe some mouthwash. Used to be, those were the only choices when shopping for dental hygiene products.
The dental aisle in any store is so overwhelming.
That's why Dr. Lee Aki and the staff at Delmarva Dental Services educate patients about what to use and how to use it properly.
The reality is that there are so many products, and there are products that could be better for you than others. And so the education on knowing what to get and how to use it properly is really key in taking care of your dental health.
Starting with the electric toothbrush or power brush.
The electric toothbrush is a game changer.
Power brushes have gone high-tech, turning what was once a basic bathroom staple into a personalized AI-powered dental assistant.
The electric brushes that are available today have a lot of features that really help guide the patient into what they need to do properly.
But that doesn't mean there isn't room for user error.
This is one of our very newer models for the power brushes.
Dental hygienist Allison Klebe gave us a quick demonstration.
So a very gentle touch is all that's needed, and you want an angle almost like at a 45-degree angle along that gum line. So you want to slowly go along very gently along the gum, applying it to the tooth in a very slow motion. A lot of people think that when they use a power brush that they're supposed to use it like a manual toothbrush and go back and forth or big circles. It's actually 1 to 2 seconds per tooth.
That adds up to about 2 minutes total, which is also what's recommended if you use a manual brush.
If you're going to use a manual brush, you need to use a soft bristled brush, not a medium or a hard brush, and you need to have the proper technique as far as angling the bristles towards your gum tissue.
Allison says many newer power brushes actually do the timing for you and let you know if you're brushing too aggressively.
It'll actually pulsate like it just did, and you switch to a different area.
Oh, wow.
Going gently along that gum line. Now watch, if you push too hard, it lights up a different color. That lets you know that you're brushing too hard, and that can actually be detrimental to the gum and the tooth structure. So just gently lighten up and go along again. With the power toothbrushes, once you've completed a full 2 minutes, it'll actually pulsate a little bit longer in your hand to let you know that you've done the right, used it for the right amount of time.
Other dental products target in between your teeth, such as dental floss.
We spend more time telling people you really need to floss more, and it's not in a judging way, it just is that we know how important it is for people to floss their teeth.
Dental floss removes bacteria that your toothbrush might miss.
But there's different types of floss for different patients. Some people have a hard time getting into the very back portions of their teeth, so we'll recommend what's called like a flosser, floss pick, floss stick. With this, the idea is basically to go in between the teeth, slightly go in, and you want to push and pull towards each tooth. So you can see I'm pushing this way, and then I'm pulling this way. It's almost in a C-shaped fashion is what we tell patients, and that goes slightly below the gum line, but it gets that bacteria out of there.
A proxy brush works best for patients with larger spaces between their teeth.
You can see just how you can get right in between here and just gently go back and forth in between those teeth. And this is a smaller one, and there are different sizes, as you can see. This is for something where somebody has larger spaces between their teeth.
A rubber tip is helpful for calming gum inflammation, and an end-tufted brush is for patients who have difficulty reaching around the very back teeth.
Especially for patients who have their third molars, their wisdom teeth. They're so much further back, and it's hard to get around that gum line.
A tongue scraper or tongue cleaner is another useful tool.
There's one side that has like the little bristles that are a little stiff, and then some that actually have almost like a little bit of a comb towards the back. When you're using a tongue cleaner, you just want to basically Go to the very back dorsal part of the tongue and slowly and gently pull forward, not pushing too hard. If you push too hard, you can actually scrape that surface. But this really helps to remove the bacteria that's in those pits and fissures of our tongues.
But perhaps the one product that has the most variations, toothpaste.
The key with toothpaste is choosing a paste that is designed to help with whatever oral hygiene you need. So for example, if you have sensitive teeth, you want to use a low abrasive toothpaste and a product more designed towards helping with either remineralizing enamel, preventing sensitivity, decreasing, it's not going to have a lot of whitening in it necessarily, things like that. If you are someone who is prone to decay, you're going to want to have a toothpaste that's designed more for preventing cavities. If you are someone who struggles with gum disease, you want a toothpaste that's going to be more active in bubbling or foaming, and that's going to actually help clean out at the gum line. So there are a lot of differences, and you don't necessarily see that when you just look at the aisle.
The good news is the doctors and hygienists at Delmarva Dental Services can advise you on what products are best based on your unique set of pearly whites. And Dr. Aki also mentioned water brushes. She says they're great tools for patients who have a lot of spaces between their teeth or patients with braces. So
the right tool for the right job.
yeah, and they're so high tech nowadays.
Yeah? Goodness gracious.